In this video, I'm going to demonstrate how to do a hospice admission. So we're basically creating an episode of care for a patient that's already been entered into the system. So we've already shown those demonstrations for adding patients and the prerequisites for that. So in this case, we've already have a patient entered in the system, and perhaps you're in their chart. So I'm going to go back here at the bottom, this little rewind button that'll show us our recent activities. So I'm going to open up this chart. And for example, this patient now is going to be admitted. So we're going to go here to episodes, add now. I'll click there, and then we go through the process of selecting the level of care, attending a physician, location, room number if necessary, the admission date, the init cert period. If they're a transfer or being readmitted, you might change that. If it's their first time, then it's going to be their first. The terminal conditions, whatever they may be, and then select the primary terminal condition, ICD-10 code, code status. You can do communication notes here, things that might be useful to other caregivers or staff. And then the last step is to select the care team. So typically one case manager, and then spiritual, obviously the provider, and social worker. When you save this, it's going to go through the process of admitting the patient, and it will also send a message to the care team. So I'll close this. So you see here in the inbox, I received a message. It also sends a message to all of the system administrators. So that's why I received a message here. Although I'm not part of the care team, I'm a system administrator. So here's the message. I can open their chart from this message down here in the bottom left. You'll typically see that button from most screens that are regarding a patient. And we see here we have future visits created for those RN case manager, spiritual, and social worker. And under the plan of care, this tab up here, it's already created the plan of care items. The RN case manager now is responsible for doing the initial assessment and then updating the plan of care. And there is another way to do an admission. So down here at the bottom, plus is where you have actions, and you can go here to admit patient. In this case, because we're not starting from a patient's chart, you'll need to put in the patient's name and select at that point, and then go through the same process. That is how you do it.